Hi everyone. I'm excited to be here and have a chance to substitute Zach. So if you were hoping to get Zach to speak, you don't have him today, but I'm the next best thing, so I hope you bear with me. No, jokes aside, I'm really excited. I think we're at a turning point, and I'm going to try and prove it to you through some slides here and some of the work that we've been doing. So I want to start by kind of anchoring this down on a true problem that I'm sure most of you know about. This is a true societal problem, right? Like there's 400 million people in the world that have diabetes, and 500 million people that are likely to get diabetes in the next years. This is a huge problem, and you can see here another stat that was shocking when I found out one person dies every 5 seconds of diabetes. So this is huge, right? And I'm lucky enough to not have anyone in my family or in my friend groups that have diabetes, so I'm very lucky, I think. But in 2018, I met a woman called Dana Lewis that some of you might know. She's been advocating for better technology in the diabetes space since, I think, starting 2015. So I want to kind of give you a bit of a sense of what it is like to have diabetes by hearing her give her insights on this. So here you go.
As a person with type 1 diabetes, I felt like I got struck by lightning when I was diagnosed at the age of 14 because I was told it would be okay. All I needed to do was measure what I was eating and take my insulin, and it would be fine. But the challenging thing is, it's not that simple. For example, insulin, while you inject it, doesn't go into effect in your body straight away. It has a peak at about an hour, and it lasts into your body for several hours, which makes it really hard to know at any given time, is it working and it's just not time yet for it to peak, or did it not work? Did I not inject successfully? Did my pump site fall out? Things like that. And it's also frustrating because there are things that make your blood sugar go up and things that make your blood sugar go down. And some of those things can make your blood sugar go up or down, depending on the day and the time and some other combination of factors. It can be really, really hard to deal with it. And that's why it's really frustrating that even with some of the best tools, like an insulin pump or a continuous glucose monitor, those help, but that still makes living with diabetes really hard. These devices aren't perfect.
So in 2018, I realized that actually technology is solving a lot of problems, but it's still not good enough, right? As she says, there is still challenges with the current technology. This is 2021. It's a paper that shows a comparison of some medical devices out there. One of the biggest challenges of these devices are effectively monitoring glucose in someone's blood is that these devices are still intrusive. They still require multiple finger sticks throughout the day to calibrate the devices, as well as needing you to insert a sensor under the skin. This is something that creates, obviously, a lot of challenges. And last but not least, it's actually really costly. You can see some of the numbers here. These are devices that are built by only a few companies out there because there isn't really a technology good enough to build better devices, right? And I think we're at the turning point. I think this is changing. And we're working with a company called No Labs that's actually developing a non-invasive glucose monitoring solution. And what they're doing is actually super interesting because they're enabling a new class of technology based on RFID, or a new class of devices based on RFID scanning. I'll let you hear directly from No Labs what they have to say about their work. Oops. Let's see if I can get this working. Just give us 1 second, we're getting the video up. There we go. Okay, well, I can tell you what this is about. It's about really going through FDA approval, right? So it's about like starting the process of of getting device FDA approved. Why is this important? It's because we're here to talk about technology and how it can help humans, right? But obviously, it's really important to make sure that these devices, and we talked about biases actually earlier, right? It's really important to make sure that these devices are actually helping people, right? And they're doing things in a controlled way, right? So I really think these processes are super important, and we're working with companies to ensure that this can happen, so that things can get FDA approved and they can be used for real use cases. Let's see if, okay, there we go. So apologies for the technical difficulties, but I also wanted to kind of zoom back a little bit and say that there are a lot of companies doing really interesting things out there in the medical space, right? I wanted to start with a real use case of something that can have a huge impact in the world. And there's a lot more of these, right? So we're working with NoWatch, a company that's developing a wearable for mental well-being, for understanding the mental well-being of a user. Aura, developing a sleep tracker based on a ring. Hive, developing a cough, an advanced cough detector. These are all just examples of companies developing real devices that are solving problems for people. And I'm sure we'll see more of this in the next few years. What makes all these devices or all these companies actually similar is the way they approach the problem, right? I've got 3 things to kind of say in this short time that I think are relevant for all of us to think about. The first one is data. Data. We need to be more data-centric in the way we build systems, right? We need to make sure that the data that we gather from these devices is the correct data. We need to ensure that this data is being gathered in the correct way. We need to ensure that we're not introducing biases. We need to ensure that the people or the clinical studies have representative data sets, that represent a set of the representative people that we're gathering the data from. All this is super important to ensure that the algorithms are going to perform and are going to provide the value that we want them to provide, right? One interesting thing here is that what happens usually on a clinical study, if the ones of you that are familiar, is that usually you end up having multiple devices on a person, on a user, on a patient, because actually you need to test your device against reference designs or reference devices. And you need to ensure that your device is behaving correctly, right? And all that just increases the complexity of the infrastructure that you need to build for dealing with that sort of data. Next point is feature extraction. So we talked about how that can also have biases, right? So we've got to be careful. But the interesting thing here is that when you speak to ML engineers, when you speak to data scientists, they usually think of this solution where you have this big model that just does everything, right? And that would be great, right? But we all know that on edge devices, on constrained devices, that's not really the way to do it, right? You really have to be intentional in the way you collect and do the feature engineering, right? You need to be intentional. So what features you use to optimize your performance and to reduce the memory that you're using and the overall performance of the system. What's interesting as well is that having multiple devices or multiple sensors means that you can create features that are more and more interesting based on the combination of these sensors and of that data coming from those sensors. So this is a really interesting point that we should all work on in terms of educating the market that this is actually where a lot of the value is. Last point I wanted to make on this topic of what makes actually people successful in developing these advanced algorithms is really thinking about the infrastructure that you need to build to enable all the data coming in the system and developing these models at scale, right? Again, these clinical studies require thousands of subjects and thousands of days of data collecting. And you need to be able to deal with all that data and relate it to each other. As well as ensuring all that data is actually bias-free, is coming from a representative data set, and so on, right? So there's a lot of challenges with that. And the last thing I wanted to point out on this diagram is what we call active learning, right? You need to ensure, this is actually interesting because someone this morning talked about some guidelines coming from the FDA, right? This is super cool. We're actually getting guidances from the FDA on ML-enabled devices, right? And medical devices. And that's interesting because it means that the FDA is starting to think about approving more of these devices, right? And helping everyone to navigate this problem. What they suggest is actually to have an active learning loop. So they suggest to have solutions for improve monitoring the model deployed on the device and improving it over time, or adapting it to potentially data drift or model drift. So this is really important, and it's something that all these companies are doing, right? They're thinking about this from the start, not as an afterthought. Shameless plug now, right? I haven't talked about Azure Pulse at all, but what we do is also enable companies like these to go faster, right? How we do that? We provide a reference design that's basically a combination of hardware and software to accelerate the deployment of algorithms on medical devices. We do this for other types of devices as well, and we have an example of a reference design in the other here in the show on the booth. So if you're interested in industrial type of algorithms, then go check that out. But here, I was just showing the reference design that we have for help. Okay, now I want to end on a kind of positive note, right? I think I made it sound like everything is really hard, and it is, right? Like this is challenging stuff, right? We are at the kind of cusp of what is happening and what is possible, right? And we're kind of pushing boundaries every day. And what's really cool to see is that actually this is it's providing some good results, right? So two things I want to show on this slide. First, on the left, you see the number of investments from VCs in digital health or wearable healthcare monitoring and diagnostic systems. So this is from Gartner, so the data is from Gartner. You can see that in the last year there's a 440%, I remember this data at this point because it's actually super interesting, 440% increase year on year in investments. And guess what? The reason for that is that there was a huge investment in a company that's doing continuous glucose monitoring. So this is a huge, huge deal, right? This is something that we're helping to solve with this new technology. On the right, what you see here is actually the number of approved medical devices that have AI enabled, or that have AI inside in some way or another. Interestingly, until 2015, right, talking about FDA approved medical devices with AI was something that you shouldn't even bring up, right? Like it was like one of those taboo topics that nobody wanted to hear about. Look at the graph, right? I mean, 2021, there was over 100 devices or companies that have their FDA approval. I want to just kind of say one comment here, or a note. These are not just all tinyML, right? This is devices in general, but it's still a good sign, right? It means that there's more confidence in AI in general, and there's more methods to get these things actually approved, these devices approved and through the FDA. So I want to end on that and just say that we're excited to work together. I think most of the room here is developing technology that is enabling people to live better lives, right? So I'm glad to be part of this and excited to work with all of you. Thank you. Any questions? Happy to take any questions.
Yeah, I just have a question about the active training part. Is it something that is going to happen on the edge, or you have to send data to some cloud? And so it's a matter of privacy. I just want to know, is it something that's going to happen on the edge and it's going to be the data is going to stay there, or you have to store it somewhere?
Can you clarify which application are you talking about?
Like this health monitoring and models that you mentioned in your presentation.
Yeah, in general, I mean, our job, I think all of us here are trying to push more and more things on the edge, right? And there's needs for that. Like, a lot of these devices are body powered, right? And they need to move with the person moving throughout the day, right? So think about your smart watches, your smart rings, or whatever else, whatever wearable device you're wearing. You want it to last as long as possible, right? So doing, we all know that turning on radios and communicating data outside of the device costs a lot of battery, right? So a lot of energy. So effectively, the less you do that, the more likely you are to have a longer battery life. So I'm very confident that more and more of these devices will be battery powered and therefore will require more computing on the edge. More questions?
answer a really quick question. What do you think we can do as an agile community to be more proactive in identifying these problems? Like in David's story, the first solution was not effective. How do you think we can try to get ahead of that, and if we can, to identify and have working solutions from day one?
Yeah, I mean, it's a question I ask myself every day, right? Like, how do we help people? Well, first you have to understand what problems they have, right? And I think so. It's all about like talking to people in different communities, different realities, and understanding really what are they looking for, right? Like, what are their challenges today? What are their pain points? And really kind of working on those, right? I really think that in the health space there's a lot of opportunities, right? And we're seeing a lot of traction because of that, because there's a lot of things that couldn't be done before, right? That we're now enabling. There's a lot of gadgets as well, right? So it's about like finding the balance and finding things that are more relevant to people. But yeah, I mean, it's about really identifying problems that users have or patients and trying to help with that. So I don't have the kind of complete answer, but I think it's all about talking to more people. So we should all go out and figure out what problems do people have and how can we help them. And maybe next year we'll present all the problems.
Thanks very much, Alessandro.
Thank you.